All those in favor?
Aye.
Aye. Okay, we'll move on to meeting minutes from the April 8th meeting. Are there any changes that you would like, that anybody would like to make, or is there a motion to approve? I'll second. All those in favor?
Aye.
Aye. Okay, we'll move on to public comments. At this time, comments from the audience may be made on items not listed on the agenda that are of public interest and within the subject matter jurisdiction of the district. The committee has a policy of limiting speakers to not more than 3 minutes. The committee cannot take action on items not listed on the agenda. Public input may be offered on an agenda item when it comes up for discussion and or action. Are there any public comments at this time?
Let's see, any public comments for items not on the agenda?
None.
None online.
Okay, so we'll move on to Chief Executive Officer report.
I have no report today. Thank you.
Okay, thank you. Move on to old business. Number 1, the grant payment schedule. Which are located in the packet. Does anyone have any questions regarding the grant payment schedule? Is there any public comment on the grant payment schedule?
No.
Okay, we'll move on to mobile medical clinics, campaigns, and initiatives.
Oh, we're on the districts. That's the foundation.
I was looking for.
I was on with the progress and final report.
Sorry. That's on my page. Okay, so program updates, progress and final report update. Are there any questions regarding the progress and final report update?
Nope.
Is there any public comment regarding that?
I don't believe so.
Okay, we'll move on to grant application status report. Is there any questions regarding the grant application status report? We'll move on to grant payment schedule, which we already said. Nobody had information. We'll move on to grant funding actions. I'm sorry. Number 1, grant number 1572, Martha's Village and Kitchen, Valley-wide homeless recuperative housing and care services expansion for $167,015. Are there any questions regarding the grant? Or any more information that you guys would like to know?
Just to recap that the funding will support some software, medical supplies, transportation assistance for the unhoused that are coming out of recuperative care into the recuperative beds, and partial salary support for the RN and the certified nursing assistant. So it's basically expanding. The district is covering the gap from RHP on the recuperative beds. So expanding 5 more recuperative beds at the Palm Springs Navigation Center and 4 at the Indio shelter. So these are individuals that are come out of the hospital, have to be ambulatory, but they need to be, just taken care of. So back to the again, they don't relapse to go back into the hospital. And we do have representatives from Martha's here if anybody has any questions.
And we've supported this before at the Angel campus, haven't we? Or-
No,
No, this is the first one, okay.
first time for recuperative beds, but we supported the organization,
Right.
and not the recuperative beds. Yeah.
I'll just add, as coming from the homeless world, and full disclosure, I sit on Martha's board. But this is not a conflict for me. Is that it's actually being shown to be a really effective model to prevent people exiting hospital situations or other healthcare facilities from falling back onto the street. So it's a really effective model. And Martha's does have a proven track record in Indio on that program.
Right. Because SB 1152 requires that.
Yes,
it's
for discharge,
Yeah,
exactly. But
so
not all of them. Ours in the valley do a very, very good job.
Yeah.
but not all of them.
I'm assuming you have some kind of marketing to let the hospital, if this gets approved at the board level, you would let the hospitals know that there's more beds.
I have a question. Are these all the grants that are in the, are we gonna see any other grants next month for this period?
That's it.
These are
Yeah.
the
This is
last,
expending all the dollars that we have left.
the
correct?
last 5. I would like to see if there's any additional comments that would like to be provided by leadership from Martha.
Is there any public comment?
With the podium.
I got you.
Thank you.
And if I may, just in clarification regarding your whatever grants are approved today, would need to be then supported for by the full board to increase the budget to accommodate.
We're looking at a 649,000.
To increase.
You just said that we went to.
For us, if we request of some office.
Oh, I said that if they're available, if they would like to address the board. I need to.
You don't have to, but you're more than welcome to, so.
Is there anything that you'd like to add?
Hi, everyone. My name is Esther Ortiz. I am Chief Program Officer for Martha's Building Kitchen. We would be grateful for the support. As we've really discussed with Donna, there is some funding cuts that are happening for the community supports, and this would greatly benefit our programs for recuperative care and the community supports that we have offering. And it would be a great addition to expand in Palm Springs, and we would really appreciate the support. Does anybody have questions or anything for me?
Does anyone have questions?
When would it funded? Is this a program that's already taking place?
This is a program that's
Right.
taking place in Indio. We have expanded to Palm Springs location. We are looking to add additional beds, as stated in the proposal. But we work with IEHP as our managed care plan provider, but through the federal funding, there is gonna be cuts coming to community support, specifically room and board. So that's where we would be needing additional support for this funding. And we have explained this to Donna and members.
Could you remind me when those cuts are being expected?
They're being expected July 1st. They're gonna be deciding. Won't take effect till January 1st, 2027. So we certainly don't know what's happening, but there is probably like a 90% chance likelihood that the room and board is definitely going away. And that is a crucial component of this program for recuperative care.
The reason why I'm asking is I know that some other grant applications are being considered for declination based on the timeline of when like the monies would be going into, or the program actually being activated within these funds. I'm not in opposition, but I think that's something for us to consider, especially if we're talking about, almost running out of money within this for grants. So I'm not sure this is something that we can hold off and maybe fund later in the year. Any thoughts, or was that considered?
The ones that are before you today were the ones that part of that 38 applications that came in that total 18 million. And from direction from the board, is to do our due diligence and look at all of the applications that met the high priority goals and also would have that direct impact in the need. And so we did do a lot of diligence. There are some that are worthy, but some of them are delayed themselves, like ABC Recovery. Their places might be built until maybe the end of the year. We were talking about the paramedic program from COD. So and then there's some of that blatantly just being, need the guidelines, but there are some that are to be considered, and if you look at our pillars, how they could align with our pillars that is really good in the future.
And the clarification is, if this grant was awarded, you're not waiting until January to implement parts of the program. You expand the beds right away.
Right.
In that aspect. It's just the room and board portion that you're basically waiting for the decision, correct?
Thank you for that.
Good question.
I'll move to send to the board for full approval.
I'll second.
Roll call, Andrea?
Thank you.
Yes. Excuse me, President Braza,
Yes.
Vice President Rodriguez.
Yes.
Chair Flores, yes.
Yes. Okay, we'll move that one forward to the board for final approval. We'll move on to grant number 1584, Reynaldo J. Sarvion Foundation, Dr. Carrion Healthcare Scholarship Program for $143,750. The information is located in the packet. Are there any questions regarding or any further information needs?
This is just a continuation of the healthcare scholarship program that Healthcare Foundation offers to students that are pursuing a healthcare career. Last year, what we funded them was 15 individuals that received scholarships. It's up to 25 individuals now. Of that 125,000 being scholarships and the balance is for support from One Future. Operating support.
I have a question. Do we have one or two other active grants with that?
One just finished, so we don't have any other active grants.
Oh,
You might be thinking of some sponsorships that.
I would move approval of this into the board first.
Okay, is there a second? Roll call, Andrea?
Here.
Oh, yeah.
Is there any public comment regarding this information?
Ricardo, what are the executive directors here? If you have any questions for him?
Anything you would like to add, interest to the board?
Want me to say something?
If you want.
If you would. Okay, thank you. I'm Ricardo Veretta, the executive director. And the short and sweet story is please approve it because and I'm very happy to report that in the last 10 years, and that includes the last 8 years that we've been working with you, we have grown every year in both the number of awards and the total number of dollars that we're making available to our community youth over the previous year. So, and this year, scholarship year 2026, we will, for the first time, be over 100 awards at 119 and way over $300,000 at $360,000. And that's because of good partners like you and others that we've cultivated in both the private sector with individuals, community organizations like Rotary clubs and Kiwanis and HOA organizations. So we still have ways we can improve, but we're very pleased with what we've done. And we know from the feedback we get from our awardees that we must be doing something right because they graduate college, they enter the workforce in good jobs, and they come back and attend alumni reunions. So there's not too much that you can't like about this. Any questions? And you would like to come to our banquet and join in the celebration, it's on June 14th at 1 o'clock at Shadow Hills High School, and wear your favorite college t-shirt or cap or whatever you'd like. If you want one from USC, I'll give you one. Thank you.
Thank you, Sarah.
No way. Can we get a roll call, Andrea?
President Barraza. Yes. President Rodriguez.
Yes.
Chair Perez Hill.
Yes. Grant number 1584 will be forwarded to the board for final approval. Move on to grant number 1604, Planned Parenthood of the Pacific Southwest. Access without delay, expanding telehealth in the Coachella Valley for $23,433. Information was in the packet. Are there any questions regarding this? Is there any public comment regarding this grant?
The Director of Grants and Dollars is with us, if she'd like to. Look at the meeting. Christie, which one? Kirsty, you have the floor if you'd like to, if you'd like to make some remarks.
Hello, I'm sorry. Yes, hi, it's Kirsten Weedy Deck. I missed whatever was just said though. Am I responding to something or just
No, we're just reviewing
Oh,
your
okay,
grant. We
good.
didn't know if you had any additional comments or thoughts.
Oh, no. Thank you very much for the opportunity to consider this investment in telehealth access for Coachella Valley residents. And I also do want to express our sincere gratitude to the Desert Healthcare District and Foundation for, well, both your thoughtful consideration of this request and your guidance, your ongoing partnership and support. So your investment has already helped expand access to essential care for Coachella Valley residents. An ongoing grant from you has enabled us to support our first ever medical doctor at the Rancho Mirage Health Center, and we are hoping to be able to provide vasectomy there soon. So it's all very exciting, and that's happening because of you. So thank you, and happy to answer any questions. Violet Spencer is also here to answer any questions that y'all might have.
Okay, thank you. Does anyone have any questions?
I'd move to recommend approval by the full board.
Second.
Okay, roll call, Andrea?
President Baraza,
Yes.
Vice President Rodriguez.
Yes.
Chair Perez.
Yes. So grant number 1604 will go to the full board for final approval. Move on to grant number 1605, Alianza Coachella Valley Air Filter Intervention and Respiratory Evaluation for Salton Sea Household Air for $297,969. Is there, the information was in the packet. Is there any questions regarding the information in the packet? Is there anyone here from Alianza that would like to comment on the?
Patricia and Ryan.
Dr. Sinclair is here, who's the main,
I saw a hand up. If you want to raise it again. Oh, there we go.
was Dr. Sinclair.
Dr. Sinclair.
You have the floor.
Oh, hi, everyone. Yeah, thanks for considering this to be funded. This builds on some of our research we've had with Alianza in the past, both on air quality and on detection of hydrogen sulfide in homes around the Salton Sea. And it really sort of leverages Desert Healthcare District's ability to have the mobile clinics, as well as Alianza's strength with the community, and then some of our collaborative partnership research that we've done together on hydrogen sulfide. So yeah, I really appreciate you all considering it, and that's all I have.
The big component is the utilization of our mobile units and the training of the physicians on detecting these different poisonous that are in the air. To ask them.
And then this would be for an 18
18
months.
I would move it to the full board for the recommend we move to the full board for approval.
I'll second it.
Okay, Andrea, roll call?
President Baraza,
Yes.
Vice President Rodriguez.
Yeah.
Chair Perez.
Yes. Okay, well, grant number 1605 will go to the full board for final approval. Move on to grant number 1609 for Braille Institute, Coachella Valley Telehealth Services, Low Vision Rehabilitation and Vision Loss Support Group for $45,000. Does anyone have, the information was provided in the packet. Does anyone have any questions regarding the information provided? No?
If someone from the organization, I would like to add.
Is there anyone here from the Braille Institute that would like
Catherine
to?
Sire is on there. She has her hand. Okay.
Hello, thank you. Catherine Sire from the Braille Institute. I'd like to just mention that this program that we're presenting here is a new addition to our low vision rehabilitation services that the Desert Healthcare District has kindly supported in the past, allowing us to expand our telehealth to the vast majority of seniors that we serve in the area. And this is an addition that has been launched in January. And just as of last week, we were able to celebrate a groundbreaking ceremony at a new center in Rancho Mirage. So later on this year, we'll be able to expand our in-person as well as telehealth opportunities through a new physical location in the area.
Thank you. From the audience? Is there a motion to approve?
So moved.
Second. Andrea, roll call?
President Baraza,
Yes.
Vice President Rodriguez.
Yes.
Chair Carrasquillo.
Yes. We will move on to grant application declinations. So number one is grant 1578 for college.
Madam Chair, if I could ask, I mean, if we've read the full staff reports on these, and obviously they exceed the allocated amounts that we are able to allocate. If we could treat these all as one block.
If we figure that out, then it would be open for public.
For public comment, absolutely.
Yeah. Okay,
Sure, okay.
so we'll just, yeah. Forget. We'll move to accept the declination.
Yeah, or what forward the declarations to the full board, correct? Yeah.
Yeah.
Are you moving that?
Mhm.
Okay, I'll second that. And then if we want,
Is
if there
there
is
any-
public comment.
Is there any public comment regarding the grants that were declined for this cycle? No public comment, Andrea, on the thing? No. Okay, can we get a roll call, Andrea?
President Baraza,
Yes.
Vice President Rodriguez.
Yes.
Chair Carrasquillo.
Yes. Okay, we'll move on to sponsorship actions. So number one is number 252613, Reynaldo J. Carrion Foundation. For their banquet, sponsorship of 5,000.
You just gave them money.
Well, the exciting thing about this one is your CEO is the tribute speaker for the event,
Oh.
so. So, you know, maybe I'm a little biased here, but I am promoting that a little bit more for the sponsoring. For the presenting sponsor, I guess, is what it's about, so.
If you pay, speakers not charge.
I know it's not going to my pocket though, so.
We've sponsored it numerous times.
We have in the past, yes.
So this is just information, right? We don't have to make
No,
a.
these are actions that if you want to do them individually or all at once.
And so
I'd recommend individually.
what's the difference between the 5,000 and the 25? Another option? Sponsorship rules.
I don't know. We did give them 2,500 last year. What the difference is, what we get, I'm not sure.
Gracie also is here and if she has any additional information since she's handling this sponsorship, the grant, the sponsorship application and. But also. Is there anything in here, Gracie? That's
Yeah, it's on the-
past and
It's on the very last
Yeah,
page.
there it is.
It says that the $5,000 is the table for 4, logo on website and materials, social media spotlight recognition during program. And then in comparison to the 2,500, it's 4 tickets, name on event signature, logo on sponsor page, and then social media recognition.
If you look at this, board does give the sponsorship history.
And then in the project description as well, it says that funds will be used for food and then for items for the recipients receiving the sponsorships.
Question?
And so I'm also looking that the amount that was requested was 4,500.
Correct.
I don't have any other questions.
Is there a motion to approve the amount for 5,000?
So,
Andrea, roll call?
President Baraza,
Yes.
Vice President Rodriguez.
yes,
Chair Perez.
Yes. Okay, we'll move on to number 252-614, Palm Springs Front Runners and Walkers, Palm Springs Pride 5K Run and Walk for 1,000.
Actually, if you wouldn't mind, giving the update information on it, Gracie, I can backfill as needed. You've got a lot of details, so you do great with it.
Thank you.
And we do have a representative here as well, so.
You want to go first, Tracy, or?
Sure. So the request was for 2,000 and the recommendation being made is 1,000. And it's not specific to one item for the event, the funds. It's just a general put into their funding bucket to be used on essential event costs. And then we have not funded this request in the past.
Okay. And would you like to give us public comment?
So I'm Brian Eckert. I'm with Palm Springs Front Runners and Walkers. We've been doing this race for about 10 years now for the LGBT community during Pride Weekend, and we're thrilled to death to have Desert Healthcare as our sponsor partner this year. So
Is there
I can
anyone-
answer, the funds that you're going to be donating will help us pay the expenses so that the money we raise through registrations, et cetera, will go to our beneficiaries. Last year, we had 11 beneficiaries, and we gave them $50,000.
Is there any questions?
What's I'm just having a little hard time finding, so within that sponsorship, what, I know that it's going to one big bucket, but I was trying to locate where it says like what we'll get like in return, but I see it now. Like the logo will be featured in promotional materials.
On our t-shirts, your logo will be on our t-shirt.
You're expecting 1,200 runners,
What's that?
1,200 runners.
1,200 properties.
yeah, it's a big event.
We're not as big as Martha's Kitchen.
Oh,
We would love to.
Move to approve the plan level 2,000.
I'll second that.
Okay, Andrea, roll call?
President Baraza,
Yes.
Vice President Rodriguez.
Yes,
Chair Perez.
Yes. So we'll move that one to the board for final approval.
Thank you.
thank you.
Thank you.
thank you.
Okay, we'll move on to 252-615, Hanson House Foundation, Inc., an evening at Copa, where rhythm meets philanthropy for 5,000. Is there any questions regarding the information provided in the packet?
I would recommend this to the full board for approval.
Is there a second?
Include a table of 10. Looking at the. I'll second.
Okay, roll call, Andrea?
President Baraza,
Yes.
Vice President Rodriguez,
Yes,
Chair Perez.
Yes. That one will be moved to the board for final approval. Move on to 252-616, Variety Children's Charities of the Desert, 1066 Annual Radiothon for 5,000. Is there any questions regarding the information provided in the packet?
sponsored this specific event in the past?
No.
We provided sponsorship previously of 2,500 and 3,000, but not this specific event.
That was somewhat recent, right?
Yeah.
I think there is a representative on Zoom. Go ahead, please introduce yourself.
Hello, my name is Nick Rossi, and I'm the Director of Development for Variety Children's Charity of the Desert. First of all, thank you all for accepting this application and giving me the opportunity to explain it. This is a really fun event that we've been doing in the Valley for a long time. The Radiothon essentially helps us fund our yearly bike giveaway. We use the radio and partner with the 106.9 station to solicit donations from the community to help us purchase bikes for fourth grade students. Every year we do a bike giveaway. So a lot of our sponsorships that we have for everyone is equated to a bike, safety equipment, and lock and helmet. And we're also tying in this year to do a bike giveaway and in turn also have a resource fair inviting other nonprofits to Acrisure Arena. So all the kiddos from every unified school district who is getting a bike, we're also going to invite the community to come to a resource fair to find the other resources in the area. So all the teachers nominate the students for a bike every year, and we go through those applications and pick out from the money that we're able to raise from our radiothon. So your sponsorship actually helps us purchase bikes for the kiddos. What you get in benefit is actually being able to come on the radio live with me to talk about anything great that's going on at the district. You guys do so much, so I'm sure there is not a lack of things that we can chat about or make commercials. There's different levels. I'm pretty sure that's in the packet for you. But it's a really fun day on the radio to get the community together and help them for our December giveaway.
If I may add, I participated a couple times in those bike giveaways, and there's not a dry eye in the crowd. And those children get on those bikes, and the parents are pushing them or guiding them. It's just so wonderful to see and experience those children that are now able to do what their peers are able to do in riding a bike and enjoying the outdoors with their family.
So Nick, are these all adapted bikes that you're giving away?
Great question. So no, the specific bike giveaway is actually standard bikes. However, we use money raised through this initiative to do adaptive bikes as well as standard bikes. However, the bike giveaway that we do every year at Acrisure Arena is standard bikes. So teachers have identified, we reach out to every unified school district, and fourth grade teachers identify students who are either doing the right thing or they know that for some reason or another financial hardships are preventing them from having a bike, or they've outgrown a bike, and they nominate their students that way. And we get to read through those nominations and pick the bikes. However, we're going to have a bigger audience this year because we're inviting the community for the resource fair as well.
I have a question.
Yes.
So this sponsorship would be for the radiothon. Would we also be included or invited to the actual bike giveaway in December? Because they have the different dates, right?
It's in there.
Yeah, so it is separate dates. You're right. And yes, it 100% would include the invite to hand out bikes to the kids on the day. That's like the best part.
Move for approval.
Yeah, last second, I just have a couple comments because I think it's hitting on a couple aspects of not just the current strategic plan, but the future about social determinants of health, so around activity and mobility. It's targeting youth, which I think is fantastic. And it's a different way of getting promotion for the district instead of just logos on programs and stuff. Not that those are bad, But the on-air radio and there's 30-second donor radio spots, I think that's a really great aspect for promoting that district. So I did second, right?
Yes.
Yeah.
And can I get a roll call, Andrea?
President Barraza,
Yes.
Vice President Rodriguez.
Yes.
Chair Paretsky.
Yes. Okay, that one will be forwarded to the board for final approval. Move on to 252-617, ABC Recovery Center, ABC Gala, a brighter chapter for 5,000. Is there any questions regarding the information provided in the packet?
I do have a question.
Okay.
So I know that the amount requested was 20,000. And what's being recommended is 5,000. Can we know what made the decision or why the 5,000 recommendation?
Essentially, I think it's actually requested for 25,000. We'd had no prior history with sponsorships with the organization, and just coming from the staff level was just recommending 5,000 for initial sponsorship.
Do we have a representative from that organization? Us?
We do. You have the floor. Please introduce yourself.
I would like to know
It is 20,000.
what the initial pitch of 20,000 was.
Hi, can you hear me?
Yes.
Hi, this is James Thomas, and I'm the Director of Fundraising for ABC Recovery Center. Thank you so much. I'm sorry I couldn't be there in person. I want to start by just saying how much the partnership with Desert Healthcare District does mean to us. We do have a relationship with you. You actually just gave us a nursing grant last year that really helped, and you did sponsor our gala last year at $5,000. So that kind of confidence really does matter, and we don't forget it. What's happening at ABC right now is something special. We're opening a 120-bed campus that is funded. It's 44,000 square feet, funded by the state. That's opening, and the grand opening is on June 15th, and we invite you all to come. The media will be there. The state will be there. We are not sure if the governor will be coming earlier for a private presentation or if he will be at the event. But we are going to be the largest addiction treatment expansion in the Coachella Valley. So the community is rallying behind it. The Berger Foundation committed $50,000 just last month. The Harmon Foundation invested $25,000 to our Building Hope campaign. Leadership Coachella Valley's class of 2026, which Nick Rossi, who you just spoke with, who's amazing, is in that class, and they chose us as their class project. And they raised more than Leadership Coachella Valley has ever raised for a class project for our Building Hope campaign, which is furnishing this 44,000 square feet. So there's real momentum here, and Desert Healthcare District is part of the foundation that makes that possible. So the presenting sponsorship at 20,000 isn't a line item. It really is a statement. It tells 300 community leaders that Desert Healthcare District and Foundation stands behind behavioral health recovery in the Coachella Valley, and your name on every invitation, every screen, every piece of outreach for the next 5 months, and then also if approved, at the grand opening really is a huge headline. As I said, there will be news presence there. There has been significant news presence over the last month at the Leadership Coachella Valley support for this. We had, I believe, 6 news appearances. No other organizations shares that space right now. And so at 20,000, I know with 900 nonprofits in Coachella Valley, it's 8% of your annual sponsorship budget, and that's a lot. But for what I'd respectfully call an outsized return. It's not just in visibility, but in alignment with exactly the kind of community health impact your strategic plan calls for. So if that full amount isn't feasible, we'd be honored to welcome you at 10,000 as a platinum sponsor. I understand if you choose 5,000, but I wanted to make sure this committee understood the full scope of what this moment is and how proud we'd be to have Desert Healthcare District Foundation's name at the top of it. So thank you so much. And again, I'm so sorry I couldn't be there in person.
James, I have another question if I may. How soon will you be promoting this event? I know that it's going to be hosted on November 5th. Like how soon are you already?
The
marketing?
the website's already up. And we are actively collecting sponsorships. It's going to be at Fantasy Springs Resort Casino, who already increased their host sponsorship from last year fairly significantly. So they are the host sponsors, but we don't have presenting sponsors at the moment. And I really believe that Desert Healthcare District's sponsorship as the lead would be incredible. Harmon was the sponsor last year, and we chose to use Harmon as a lead gift for our Furnishing the Future campaign this year instead. Yeah, that's where we stand. So the promotion would be immediate. We would activate that immediately. We actually don't have press releases going out for the grand opening yet, and so that would be included in that as well. So it would be fairly immediate.
Are there any other questions?
So maybe a conversation on committee members that I'm considering a higher amount. And if that's the case, I'm not sure what you all be comfortable with based on the information that's being given. It's a great program, like mentioned it. This wouldn't be the first time that the governor visits the center, right, James? I believe that he was.
No, actually, so the governor was there in 2022 when we did the groundbreaking. So, and we're just so excited the fact that, now it's coming to fruition. And so, I mean, this is a momentous occasion. That's why we're calling the gala a Brighter Chapter. I hope it means to everyone else what it will mean to the hardest hit populations that we have.
I remember the district was invited to that when the governor was here. I would like for us to consider a higher amount based on like the benefits of sponsoring this event and not only that, of course, supporting the center, ABC Recovery Center. But I don't know what your thoughts are, or if we wanna.
Do we have any open grants with them?
Don't currently have any open grants with you. We do have a request. We did have a request in that, unfortunately, because of so many requests that you get, we haven't. It wasn't able to be fulfilled this year. But trust me, I have one in the bank waiting for you for next year.
What amount are you proposing?
I mean, I would even like us at the presenting sponsor 20K and like just being like that partner next to them. But this is, I guess, a sponsorship for just an event. So.
Yeah, I just want to add real quick, and I don't want to interrupt, but this really is a once in a lifetime moment for us and for Coachella Valley that I really want Desert Healthcare District to be involved with.
You could consider that and then have a full discussion with the boards.
I would support that actually.
I'll move it to the board for full consideration at the presenting sponsor level of 20K.
I'll second that.
And Brian, can I get a roll call?
President Barraza,
Yes.
Vice President Rodriguez.
Yes.
Chair Paleski.
Yes. Okay, we'll move on to 25261. Visión y Compromiso 24th Annual Conference for 5,000. Information is provided in the packet. Is there anyone here from Visión y Compromiso that would like to say something?
I do have a few questions before that possible. Right?
Yes.
Similar question. The requested amount was 25,000 for the sponsorship and the recommended amount is 5,000. I would just like to see or understand.
Yeah, and I apologize on the prior one. The communication I'm giving now was meant for the first one. So I apologize that I was correcting the 20,000 request for ABC Recovery then, and we had provided 5,000 previously. But the communication on this one is, yes, it is 25,000 request. Just there's no prior history. And so just the recommendation of the 5,000, but it's certainly up to the community or the committee members to determine otherwise.
So what were going to be like the benefits or the reason behind like a $5,000 level?
Just initial starting of $5,000 for providing to a sponsorship request.
So would you be able to like tell us the difference? Like, oh, we believe that at 5,000, the district would be at this level of.
I didn't analyze it that deeply, no.
Okay, thank you. Have any other questions? Or you were gonna have someone from the organization on this?
You have the floor. Please introduce yourself.
Hello. So this is Melinda Cordero Bárzaga, I'm the Associate Director of Programs for Visión y Compromiso, and also in the queue is Jessica Charia, who's one of our executive assistants. So I don't know if you have any questions for me, but what I can say about our conference is, first of all, we're very excited to actually bring this conference to the Coachella Valley. This conference has been in past years, the last 23 in LA County and last year in Orange County. And so this year we're happy to be able to bring it to the Coachella Valley. Many times the promotoras and other community health workers and leaders don't have the opportunity to go to the conference because of the distance and the cost that they incur. Many promotoras are not, and CHWs don't have the professional fees and the budgets of their organizations to be able to partake in these kinds of conferences that provide exposure to them. It is a 2.5-day conference full of workshops and plenaries and opportunities for exhibitors. So for them to gain more resources and more information and skills to be able to take back to their communities. So we believe as one of your grantees and partners, and understand that this has been historically one of your priorities, to support the promotoras during this time would be an incredible, I think, opportunity for the Desert Healthcare District, as you have over many years. Now, you've provided a lot of funding to many organizations and their projects to do outreach, education, and more. This is really an opportunity to say to promotoras and community health workers, we want to see you grow and want you to continue to expand in your profession. And, the support from you, I think, would say that very, very clearly. So not just for them to do the work of outreach and education, but also to continue growing and expanding their professional trajectory as promotoras and community health workers. So each level of funding, and I'm not sure if you have that in your packet, does provide different benefits for the sponsor. And so if you don't see those, I can definitely, Jessica or I can go through those with you if you need more information.
Yeah, we have them.
Perfect. So it's an opportunity for that visibility, but I think, again, also your history has shown that you've provided a lot of support for promotoras to do the work, to be employed. This is really an opportunity for their organizations to send them to this conference, which is in their region, and to, gain more of those skills. Again, it's really an event that is educational and celebratory of the work that they do as community health workers and leaders in the region. So it's also something you should know. The registration cost for this, and this year it's at the Palm Springs Convention Center, is very low for promotoras. I'm sure all of us have attended conferences and understand how much conferences cost. We only charge $50 for promotoras to attend a conference that includes 2, 4, 5 meals. And so the support really is to help us keep that cost low for the promotora to attend, but to offset that cost. This is not a gala, it's not a fundraiser, it's not a moneymaker. We do not make any funds off of this conference. It's really an act of continuing with our mission of supporting and elevating the promotora and the promotora model.
Could you elaborate a little bit more on like the marketing and visibility opportunities here locally? Because I know that this is also statewide. But I'd be interested in to see if you have any info on that, like what would the impact be here? As one of our goals is expanding the visibility or.
Yes, absolutely, absolutely. That's a great question. And we have already made contact with the local outlets to be able to begin to create that relationship and that anticipation for the conference. So one, we're already putting out the information about this conference through our own social media and our own email blast. But then in the media, the actual news, etc., we are already in conversation with Telemundo and NBC to be able to speak more about the conference and, of course, the visibility. You know, the logo is placed on everything that we send out, from our website to, you know, of course, our press release, to all of our materials are also branded with the logos of all of our sponsors as they come in at the different levels.
I think that this would be a great event, especially as it's supporting promotoras and the work that we've done, and then not just the organization, but the actual promotoras seen as a partner to them. I would like for us, and then we'll see what my fellow committee members have to say, but I'm thinking maybe more on the Vision, the 10K level. That will, our logo will be featured on print and digital. We'll have a quarter-page promotional ad within the program. There'll be speaking opportunities, conference registration, for their luncheon, and then we'll also be able to place a exhibitor booth. So
I'll second that because I would recommend the same thing.
you were going to, okay, all right.
Okay, can we get a roll call, Andrea?
President Barraza,
Yes.
Vice President Rodriguez.
Yes.
Chair Perez Hill.
Yes. Okay, that one will be moved to the full board for final approval. Thank you. Move on to grant number 25267, Martha's Village and Kitchen, 20th Annual Thanksgiving Day 5K for 10,000. Are there any questions regarding the information provided in the packet?
They would be the same questions, so the amount that's being requested being different from what's being recommended. And then from the organization, I would just like to hear their pitch on why they were requesting the 20K, but we can hear from staff first.
I just gave a number to consider.
No other, anything else, just a number.
We funded them in the past, right?
I don't think we provided sponsorship before. That was part of my logic of giving a little extra, but
Oh, okay. Okay, is there anybody here from Martha's Village and Kitchen that would like to? Oh,
Hi, I'm Alicia Grantham. I'm the Chief Development Officer at Martha's. Thanks for this consideration. So this is Martha's 20th year for this event, and it's going to be bigger and better than it's ever been. In the last 2 years, the participation rate went from 2,700 up to 3,100. We're anticipating 3,500 participants, but overall, as far as the volunteer efforts that came together, this is for non-residents, residents, the volunteers, just spectators. It's usually about 5,000 to 6,000 people in that one environment on such a special day. So we did ask for the $20,000, which is the champion sponsorship level, because this is Martha's sole fundraising event of the year. And we put all of our effort into this. It takes a lot to pull this off. And we try to keep the registration reasonable for the participants to come and enjoy this event with us on that day. So really the money that we're raising is that those are from sponsors. That's really what we are able to bring in to support the comprehensive services that we provide at Martha's. We do feel very strongly that this aligns with the healthcare district's mission. You know, we're all about we're all about helping this community. One of the key, and this is something that we're really stressing now, is we're addressing key social determinants of health, housing instability, and food insecurity. And those are two of the biggest things that we do. So yes, we would really like to see Desert Healthcare be one of our sponsors. The difference in the 20 and the 10, as you've brought up with others, you do get placement on stage, like signage on stage, which is very visible. It's a focal point of the entire event, where the event begins, and that's where the event ends, and then everyone funnels into, I don't know if any of you have ever attended the event, but it's a lot of fun. So yeah, we just hope that you'll consider that and just appreciate the opportunity to be here.
So you guys, those great turkey hats.
We're gonna have tutus again this year too.
Yes.
So, yes, we're going all out.
So it's a fun event. You get to burn the calories in the morning and then you replace them in the evening.
Are there any other questions?
I'm going to abstain on this because as a board member, I'm part of the development. So
So the recommendation is for 10K. Looking at the differences, we see, for example, one of them is the complimentary response. The 20K, we'd be getting 25 entries. In comparison to 7, I'm not sure we need 25 of them. I know that I hope you're funny for sure, but I mean, I'm mentioning it so that we know. I think that for this one, at 10K, we're so the logo will be placed on their t-shirts, within their like newsletters. Just comparing the sponsorship levels, I am comfortable with a 10K. So I move to send that, to approve the recommendation and send it to the full board.
Okay, I'll second for the 10K. Andrea, can we get a roll call, please?
President Barraza,
Yes.
Chair Boresky,
Yes.
no, not I.
you abstain.
Okay, we'll move that forward to the board for final approval. We'll move on to number 25268, American Heart Association Coachella Valley Heart Walk for 5,000. Is there any questions regarding the information provided in the packet?
No questions, but do we have a representative?
Is there a representative here from the American Heart Association?
I don't think so. Normally it's Mary, if I may, Chris, she if you guys recall at the board meeting, we provided an impact report from last year's stroke walk that they had.
And we had provided 5,000 previously, so that was my recommendation.
I would move to recommend the approval of 5,000 for the full board.
I'll second.
Andrea, roll call?
President Barraza,
Yes.
Vice President Rodriguez,
Yes.
Chair Boresky.
Yes. That one will be moved to the board for final approval. We'll move on to sponsorship actions, number 252-618. Seroptimus International at the Golden West Region. Rendezvous at the Big Top 48th Annual Spring Conference for 2,000.
And Madam Chair, if I could, as we did on the grant, since these are just notices of declination, we could treat this as a block, as an informational item to the board to take action.
I think the first two are action items.
First and two were intended as action items. We did not, at the staff level, define those. Item three does qualify for what you're speaking.
Okay, because I'm just reading the title, it says
Yeah.
termination of declination.
Yeah.
Okay, I'm sorry.
Was there a reason why they're separate from the original or the previous sponsorship?
The reason the difference is these fall within dates that are, ahead of time. So I'm bringing them to the committee for the committee to decide. The ones that are under item 3, those were essentially short notice, responding by staff. And they would have been too late to even bring to the to the committee for consideration.
Oh, perfect, okay, thank you for that. So this item, the staff recommendation is to decline.
Correct.
All of them, 1, 2, and 3?
Well,
What 1 and 2 are for committee consideration to decline.
Oh, I see.
Item 3, staff already declined. And they're informational. The
Okay.
first 2 would be action. Item 3 have already taken an action by staff. Are informational.
Number 1, is there a motion to decline or a motion to approve?
I'll move to accept that recommendation.
Is there a second?
just really quickly on that one, what was the reason for declining it? It did not align?
Yes, I believe that was the reason that losing battery are here, so.
If I may add, it was because the funds would be directly provided to the women who would be receiving the award, so it would be pass-through funds.
Would that be something similar to what we do like a scholarship?
I don't think it follows that same process. I think they just give like the check or funds directly to the woman instead of it going, because it's going towards educational fees, but the funds are not provided to the educational institution, they're just provided to the individual director.
So we would be, like, if this item were to be approved, it would be going for like a check from the healthcare district to
To an individual.
individual.
Scholarships, it goes directly to the.
Organization.
Oh,
Did you have a conversation with this organization to see if that was the only option, or if there were other options, or they would wanna reconsider? Did we communicate with them at all?
No.
We didn't? If it'd be okay with the committee, maybe we, not that we necessarily wanted to go reconsider, but maybe have a conversation with them to find out if what they anticipated, or for them to actually know that that's something that we can do.
The event is June 5th as well.
I just feel that I believe that anybody that submits applications for sponsorship should receive at least a call or some sort of communication from us. Do we have anybody on Zoom that's with the organization? So what would be our other option if we're not gonna approve, to move it forward as a declination? Can we table it so that we can get more information? And then also, I would like to emphasize that, again, we should be reaching out to these organizations.
We make the motion to not make a recommendation for declination or approval to the full board for their consideration after we obtain. The staff should be able to get some type of information to provide at the board meeting, correct?
Or we can give it, pass it on without an actual recommendation until we hear back from them.
That's what I mean.
Yeah.
But to Chris's point, it's events on June 5th. We should address it at this board, meeting, right?
The next.
Yeah. That work?
Will it be enough time though for them to prepare for that? Since our board meeting is almost at the end of the month.
Well,
And the things that we,
if they decide not to, if we were to approve it and they decide not to accept it, then I guess that's fine.
I think part of the thing, if I may, we should be considering is, you know, these last minute kinds of requests really put staff and the committee, as we're seeing, in kind of a predicament to make this decision in a timely manner. And I mean, I had considered just declining it, you know, based on that, but I did bring it to the committee, and the committee would like us to do more research on that, which typically hasn't been part of our policy, and we can add that to the policy. So it's kind of a new additional request that, you know, we're happy to do. So whatever committee direction is, staff will do.
Thank you. So then, that be considered a motion? Okay.
Yeah.
so can you send your motion again?
Yes.
So it would be to move it to the full board without any recommendation and for staff to provide that's what it's.
Staff to communicate.
Yeah, thank you.
So staffs to contact the organization to find out if they would reconsider how they want to apply their money.
Just sort of letting them know, or at least having a conversation or communication with them. And I would also recommend with anybody that applies for sponsorship that we should be contacting them.
Okay, can I get a roll call, Andrea? You seconded?
Yeah. President Baraza? Yes. Vice President Rodriguez?
Yeah.
Chair Perez? Yeah.
Yes. We'll move on to 252, 619, Riverside County Office of Education, Greater Coachella Valley Student of the Month for 5,000. Is there anybody here from the Riverside County Office of Education?
I would move to approve or accept the staff's recommendation to decline based on it not aligning with our high priorities.
Andrea, can we get a roll call for that one, please?
President Baraza?
Yes.
Vice President Rodriguez?
Yes.
Chair Perez? Yeah.
Yes. Okay, then we'll move on forward to the board. The next three are declined by you guys, right?
Correct, just information.
Just information.
No action needed there.
Would you guys like to look at them as a whole, or do you have any questions regarding any of the three?
So I looking at one of their notes within the declination note. There isn't anything, could stop just to write some information on why they're being recommended for it to be declined, and then I'm okay as well to vote on them as one whole piece.
If they're informational, they're not an action.
We need to vote. I thought that they were, that we needed to vote. So for information, could you tell me if it's not on there?
The first two, if I recall, I believe we received them on a Friday and they needed the commitment by a week later. And so it was too short of notice.
And then the last one.
I believe this one, help me out.
Yeah, that one was not in our area, so it's out of district.
Marco. Thank you for that.
Is there any other questions regarding these three? No? Okay, we'll move on to committee member comments. Are there any committee member comments at this time? Okay, I'll adjourn the meeting at 5:09 p.m. Our next